You come in for your appointment, you're quite nervous, so you're put into one of our patient suites and you're told to be feeling nice and comfortable. Then I will call you into the actual clinic room. We'll go ahead, shout out a bunch of numbers and letters just to tell what teeth are present, what teeth aren't there. We'll then get you ready to do an X-ray scan. This 3D X-ray scan gives us all the information that we need to decide and work out if you are a suitable patient for our 21D solution. And I'll bring you back into the room where my lovely nurse will take a blood pressure reading and also do a couple of other scans. One will involve a face scan. That will just give us your smile and your neutral sort of face. And finally, we'll do an intraoral scan. We use a little camera inside of your mouth and we just take loads and loads of little pictures of what we see inside your mouth, so we can make you available for surgical planning without you having to leave the comfort of your own house.